Today we're diving into a healthcare crisis that has absolutely nothing to do with medicine and everything to do with politics. It's a story about how budget fights in Washington are directly threatening the way millions of us get our medical care. Okay, I want you to picture this. It's October of 2025. The federal government grinds to a halt. It shuts down. Now, for a lot of us, that might feel like a distant headline, right? But for thousands of patients and their doctors, this political fight suddenly became incredibly real. And this quote, this is from the government's own guidance during the shutdown, and it just says it all. You had patients who were stable, they were recovering in their own homes, and they were forced back into hospitals. Why? For no medical reason at all. The only issue was that the piece of paper that funded their care, it had expired. It's just a brutal example of policy getting in the way of patient care. So let's start right there, with the immediate human cost of all this political gridlock. What actually happens on the ground when somebody in Washington decides to pull the plug? Well, here's what it looked like. Those essential Medicare telehealth waivers, the ones that let doctors treat you over video, they just vanished overnight. Those really innovative hospital-at-home programs were stopped dead in their tracks. And as we just heard, that meant patients were literally moved mid-treatment, causing all sorts of chaos. And for the doctors and nurses, they had this impossible choice. Either keep working and just hope you get paid someday, or start turning away the very people who rely on you. Now, what's really terrifying here is that this wasn't some freak accident. It's not a one-time thing. This is a recurring nightmare. It's a systemic problem, a cycle of uncertainty that is baked right into our healthcare policy. And this timeline, well, it tells the whole story. You see, before the pandemic, telehealth for Medicare patients was pretty rare. Then COVID hits, and bam, these emergency waivers blow the doors wide open, and it proves just how vital this technology is. But then, when the public health emergency officially wrapped up in 2023, you'd think we'd make it permanent, right? Nope. Instead, Congress just started kicking the can down the road with a bunch of short-term extensions, each one tacked onto a must-pass budget bill. And just like that, telehealth survival became a political football. Which brings us to this key idea, legislative hostage. It's a really powerful way to describe what's going on. You take a super popular, super important program like telehealth, and you attach it to these gigantic, must-pass spending bills. It basically becomes leverage, a bargaining chip that can be thrown away in a fight over something completely different, with patients and their doctors just caught in the middle. So, it begs the obvious question, right? If telehealth has all this support, from both parties, from doctors, from patients, why on earth can't we get a permanent fix? Why are we stuck in this crazy loop of uncertainty? Well, it boils down to four main roadblocks. First, there's something called budget scoring. The way the rules are written, they focus way more on the upfront cost of telehealth, and they often ignore the long-term savings from, say, fewer ER visits. Second, there are some real concerns about fraud, but the answer to that should be better oversight, not just shutting the whole thing down. Third, when you've got these massive fiscal showdowns, a program like telehealth just gets lost in the noise. And finally, let's be honest, it's just easier for lawmakers to kick the can down the road with another short-term patch than to do the hard work of creating a permanent solution. And this quote from Kyle Zebley at the American Telemedicine Association, man, it just perfectly captures the frustration. You can feel it. Everyone's grateful for the support, sure, but gratitude doesn't help you plan or invest in the future. At the end of the day, they are still the victims of this political game. And all this instability, this constant uncertainty, it isn't just an inconvenience. It has a real, tangible price tag for the entire healthcare system. Just look at this number from MedPAC. Every single month, we're seeing 35 to 40 telehealth visits for every 1,000 Medicare patients. Let that sink in. This isn't some tiny pilot program anymore. This is a core part of how healthcare is delivered in this country. And that makes this constant political instability not just irresponsible, it's just baffling. This chart just lays out the disconnect perfectly. On one side, you have what our healthcare system actually needs to function: stability, so they can invest in technology, the ability to plan for the future, clear communication for patients. But on the other side, you have the reality that this policy creates: just constant uncertainty, endless crisis management, and a huge administrative headache that pulls time and money away from actually taking care of people. So, after all that doom and gloom, the big question is, how do we fix this? Is there a way to break this destructive cycle? Well, the good news is there is a clear path forward. The solution is really about treating telehealth like the serious, critical piece of healthcare that it is. So step 1, untie it from the budget drama. Pass it as its own standalone bill. Step 2, okay, if a permanent fix is too much to ask right now, then at least authorize it for 5 to 7 years, not just a few months. Give these health systems some breathing room to plan. Step 3, make the core parts of it permanent, but build in regular reviews to make sure it's working properly. And step 4, use actual data, real evidence to decide what comes next, not political games. Because ultimately, this is what it all comes down to. This constant state of emergency, this governing by crisis. It's just no way to run a healthcare system. Patients and the people who care for them deserve predictability. They deserve stability. They deserve policies that are designed to help them, not hold them hostage. And that really leaves us with one final sobering question to think about. When a lifeline like telehealth gets turned into a political bargaining chip, it's not the politicians who are at risk. The price is paid by the patients, who suddenly lose access to their doctors, and by the providers just trying to care for them in a system that feels like it's built on chaos.